Alright, team. We have a patient presenting with intertrigo, glomerulonephritis, and urethritis. What are we thinking here?
Those symptoms could point to a variety of conditions. It might be a bacterial infection or an autoimmune disorder.
I'm leaning towards a systemic issue causing these symptoms. Maybe something like sarcoidosis or another connective tissue disease.
Could it be a genetic disorder affecting multiple systems? Possibly something rare that we haven't seen before?
I'm not so sure about any of those guesses.
I think we need to run more tests before jumping to conclusions.
Enough. It's periodic paralysis, no doubt about it. And we can't waste any time. The patient needs a laminectomy immediately.
Wait, are you sure about that? Laminectomy is a risky procedure, especially without a confirmed diagnosis.
I don't have time for doubts. This is the right course of action and we're moving forward with it. Now, scrub in everyone. We have a surgery to perform.
Are you going to join us in the surgery?
Today's not a good time. Tracy's gonna raise hell over this and I've got a good excuse this time.
What are the white cards in the Hypocritical Oath expansion pack for Cards Against Humanity? What the hell are you talking about?
Well, when I assembled my brilliant team of doctors, we used that card game as an icebreaker. It wasn't going anywhere until I remembered I had an expansion pack.
You've got to be kidding me. The Hypocritical Oath?
Yeah, we both swore on it before we became doctors, didn't we?
You're thinking of the Hippocratic Oath.
I didn't swear allegiance to a hippo. I swore it to the hypocrite. Do no harm unless they do it first.
You're insane. You want to perform a laminectomy on your patient with what you think is periodic paralysis? All because of a combo of cards. Was it even a winning hand?
In my heart, it was. The room fell silent when it was said as a complete sentence.
Can't believe I'm asking, but what was it?
Mr. Williams, you have periodic paralysis. To make it permanent, we must perform a laminectomy.
That makes even less sense. Don't you dare go through with the operation.
Operation's a separate game, Tracy.
Crap, the patient is in critical condition. We need to act fast.
I can't believe that Dr. Hawks went ahead with the laminectomy knowing it wasn't the right treatment for periodic paralysis.
His excuse was even stupider this time. He swears we played Cards Against Humanity with him.
He did that with me, Frank, and Kelly when we all got hired. We were in a pool of 10 possible hires, so Hawks selected the top 3 winners.
That explains a lot now. Who had the most black cards?
Technically, Hawks because he owned the game.
What the hell were you thinking? Periodic paralysis? Laminectomy? Are you all trying to kill our patient?
Sorry, Hawks, guess we were dealt a shitty hand.
I don't have time to hold your hands through this. Figure it out yourselves. Use your brains for once.
But we need your expertise, Dr. Hawks. Please tell us what you think it could be.
You all make me sick. I can't believe I have to work with a bunch of incompetent fools like you.
We'll do better next time, Doctor. Just give us a hint or some guidance.
I've had enough of this. Figure it out or get out of my sight.
We'll do our best to make it right, Dr. Hawks. Please don't leave angry.
I can't stand to be in the presence of such incompetence. Sort it out or you're all out of here. Hey, Johnson. How are things going in the oncology department?
Pretty good, actually. Most of my patients are responding well to treatment. How about you? Any interesting cases lately?
Yeah, there's this one patient I just can't figure out. It's like a medical mystery.
Oh, those are always challenging. Have you tried looking at it from a different angle?
I think I just had a breakthrough. It all makes sense now.
Wait, really? What did you find?
I'll explain later. Gotta go attend to my patient. Thanks for the chat, Johnson.
Hey, are you in the mood for cards later tonight?
No, Tracy confiscated my game so she could actually find the expansion pack I made up. Sorry for barging in, but I had to report something urgent.
You can't just come in here without protection. Are you trying to get us all sick?
Seriously, Hawks, what were you thinking? You know better than this.
This is highly unprofessional. You're putting everyone at risk.
Listen, I know it was reckless, but we have a new development. Periodic paralysis was a misdiagnosis.
What do you mean? What's the right diagnosis then?
Diphalia. I figured it out over lunch with Dr. Johnson.
Diphalia. What's the prognosis for that?
Is it treatable? How do we proceed?
The prognosis is good. Surgery is usually necessary, but it's a straightforward procedure. We can start planning it now.
You heard him, team. We're performing a diphilectomy.
Oh, shut up.
Thanks for acknowledging my correction on the diagnosis, Tracy. It was indeed dysphalia, not periodic paralysis.
You did a great job catching that mistake, Hawks. The patient is lucky to have you on the case.
If only you hadn't taken away my pack of cards, we would have pulled the right one out earlier.
That's a load of crap. I couldn't find a single card in here dubbed periodic paralysis or laminectomy.
They were dry erase cards, custom answers, basically wild cards.
So why did I find one card with permanent ink that said Liz Tracy?
Sometimes, the best answer is standing right in front of you.
What was the question you felt my name was the perfect answer to?
It's days like this where I wish I could call your mistake blank instead of a fuck-up.